According to statistics, cardiovascular diseases, heart attack being the major killer, is the leading cause of death globally, with over 17 million people dying yearly as a result. In Africa particularly, it is estimated that by 2030, coronary heart disease is going to be the leading killer. It is alarming that, contrary to popular belief that the disease affects older people, in Kenya, this deadly disease seems to be hitting people from as young as the age of 20 to 40, unlike in the West, where the disease affects older generations. Without the demystifying of this myth, huge numbers of youngsters will continue to lose their lives. We managed to speak to a cardiologist, a heart attack specialist at the Aga Khan University Hospital, Dr. Mohammed Jailan, who was keen to tell us more about this disease. According to him, the disease was not common among Africans before the 1960s, and he attributes this to our lifestyles then, saying that they were much healthier and comfortable.
The reason why 50 years ago people thought Africans didn't get this is because Africans didn't have those habits. But now we've adopted those habits, and with those habits we've adopted the problems.
Even as we continue to mourn the number of deaths caused by the disease, what are some of the causes of cardiovascular disease?
Why do people suffer heart attacks? There are a number of reasons. The most powerful causes are smoking, diabetes, and a strong family history. Having a body that produces a lot of cholesterol can also put you at risk. And then having other lifestyle habits, like being overweight, like not sleeping well, like getting stressed, and like having poor exercise habits will increase the chances of you getting this. Sleep is an interesting situation because sleep is supposed to occupy a third of your life. 8 hours per day, or 33% of your life you're supposed to sleep. So many things happen during sleep. Your body resets itself. And many times when your body's resetting itself, the hormones are being rebalanced. The liver is being given an opportunity to manage cholesterol. Your blood pressure starts to settle and your heart rate settles down. After sleep, when you wake up, if you've not had good sleep, because you're irritable, you're much more likely to have high blood pressure. You're also much more likely to take on bad habits.
Dr. Jailan, however, clarified that changing one's diet can only do so much in terms of prevention, but stated the main way Kenyans can prevent cases of heart attacks is through exercising.
What we now know is that diet causes obesity. It doesn't, in most patients, cause problems with the cholesterol. That's related not just to your diet, but also to your liver. So we do not try very hard to push the diet message. What we do push is the exercise message. So the first thing to do is think about what it is that stops you from exercising, even in the workplace. If you can exercise more, running up the stairs, walking all the time, then do it. Every time you have an opportunity to exercise, do it. And you'll do it, and you'll be okay. The challenge that people have, especially when their lives are very busy, is that they find it difficult to find time to do the exercise. So do it when you're just in your normal living day.
He promoted the idea that people should incorporate exercises into their daily routine, even in the workplace, and also have decent and comfortable clothing for such workouts. He said people in storied buildings should opt for stairs rather than use the elevator whenever they can. We took a glimpse of a patient under treatment whose heart was rectified after she suffered a heart complication. The patient was brought to the doctor after her local doctor back in the village could not diagnose the cause of the pain she felt on her chest. The patient complained of the chest pain mostly when she walked up a slope.
This tube over here is called a catheter. It's come up the patient's leg, And through that, we're injecting some ink, some dye, which is black. And you can see the heart is a moving structure. It's pumping as we're injecting the dye. And you can see in the middle here, just after that first branch, that the vessel, which is starts off quite fat, has been pinched in the middle. And then it continues in its normal size. So over here, this would be a narrowing somewhere over here. The whole of the right side of the heart after that, and the left side of the heart after that, that depends on the blood supply, is now getting much less blood. And the normal process is for this to slowly get smaller and smaller, and in many cases it results in a heart attack. What you can do to try and prevent a heart attack? The first thing is, if you find this problem, to start taking medication like aspirin and cholesterol managing drugs. If the situation is quite severe and the patient is getting symptoms increasingly, then it's recommended to do something called angioplasty to try and prevent it, because it means that you now have an unstable situation. And in this patient's case, what we did was we found the problem, we confirmed that the patient's symptoms were becoming increasingly severe, and we knew that she had an unstable situation. And we then proceeded to do an angioplasty.
The recent rise of misdiagnoses in hospitals, many of them are attributable to wrong equipment and lack of expertise. An ECG procedure is the only way to diagnose this.
Is it possible for the diagnosis to be missed? That's the first question. You can come to hospital, you have chest pain, you're told everything's okay, go home, and then a few hours later you suffer a heart attack. It is possible. Usually we invite people to spend 24 to 48 hours in hospital, because what might appear during the moment of chest pain may disappear when you're not having chest pain. If you're having chest pain and we can't see anything on the ECG or on the heart scan or on the blood test to see if there's any damage to the heart, it's highly unlikely that you're having a heart attack. If you go to any clinic and they offer to do a typhoid test or a malaria test, but they don't offer to do an ECG, then you need to find a place where they're going to do the ECG, because that is the only way to detect whether you're having a heart attack or not. So an ECG takes about a minute to prepare, 10 seconds to do, and another 2 minutes to interpret if you don't have a specialist on site. And within 5 minutes of arriving at a hospital and having the ECG done, a decision can be made quickly about what should be done. Well, the ECG is this amazing test. It's not very expensive. Some hospitals will offer it for 500 or 600 shillings. Sometimes it's 1,000 bob. Sometimes it's a bit more. And what the machine does is you're connected to a machine using 10 electrodes. You don't feel anything. It's just like a sticker being put on your body, on your arms and your legs. And an ECG is recorded through a small computer. And it looks at the electrical activity of 12 different parts of your heart. And if you're having a heart attack, you'll expect to find a problem in at least 2 of those parts. And that will be the big clue that there may be a big heart attack happening.
All is not lost, as more county hospitals are training their medical personnel on how to carry out an ECG and possibly prescribing drugs.
What should you do if you feel chest pain? If you feel chest pain and you find that it has a pattern of angina, it walks, when you walk, it increases when you stop, when you do exercise of any form, when you stop exercising, whether it's making the bed or nafagia, whatever it is you do, if you find that that symptom is occurring, then you definitely need to see a doctor. If you don't know whether you have diabetes or high blood pressure or high cholesterol, then you need to find out. And anyone above the age of 21 should get themselves checked at least once every 3 years to find out if those conditions are present. Because if you have them and you treat them early, then you have a good chance of preventing yourself from getting heart disease.
Reporting for Hope TV, I'm Grace Wangoi.